as a subgroup for the aging in place. I think what I'm going to do is pull up the agenda, or I'm sorry, the meeting minutes to remind us of what we talked about. I think there's a really good summary of where we landed for priority, and then we can approve them from there if that works for you both. Okay.
Sure. Sounds good.
All right, so here's our minutes from last time when we met in December. So as a quick reminder, we went through, we were the recipients of a presentation by DART, and then we talked through our priorities, discussed the relative both importance and difficulty, and then it looked like we really landed around outreach and dissemination of information around services, family caregivers, and memory care. And it looks like in some of that outreach, we could also, we all kind of came together around fighting stigma and a positive messaging around aging. So if that sounds reflective of the minutes and where, the meeting you were in, can I get a motion to approve our minutes?
So moved.
Okay, and a second?
Second.
Thanks, Maggie. All right, so we'll approve the minutes, and then I'll use them as my cheat sheet to keep us on task for next steps. And then I'll stop the share just so that we can look at each other. Welcome, Matthew. Thank you for joining us.
My apologies.
No worries. It's a Monday morning, I think, for all of us. So we just went through the minutes, approved those. I used it to remind myself where we had landed at the end of everything in December. And it looks like what we really agreed to as a group were that outreach and information sharing needed to be part of our priority, just to make individuals aware of existing services, but then also in the arena of family caregivers and memory care, that was an area we all agreed was important and needed more development. And it looks like there's also messaging around healthy aging and kind of changing the conversation on aging. And I'll tell you, that's something that's come up certainly in the social determinants of aging well, that we're really looking to find ways as we shift the aging system to shift the conversation as well, and really, talk about vitality in this large segment of our lives, as opposed to, the focus on all the ageist language and just general attitudes, really. So with that said, I guess I'll stop talking for a minute and just see if there's any particular place that you all are interested in jumping off from.
Well, I think that, what you just said, Melissa, is really important. And that's one of the things that I've brought up during our conversations. But in the email that was sent out on the 8th, that Will sent out, he did, have some bullet points about the things that we talked about. And, the information dissemination was one. And then he also talked about utilizing community navigators for programs that partner with the state, but that are not necessarily public employees, to provide the information and assistance. So that was something that I was thinking about, that if we, I know that on the last work group meeting, I guess that was in January, Carolyn Fredericks from Modern Maturity Center commented that she had, at the beginning of the pandemic, they had put together a list of resources on, I think, a 2-sided sheet that they shared with their meal recipients and others. So that might, and I know that the division certainly has, we have the big guide, which is wonderful, and it's online, and that's great, but the handheld piece of information could be useful. And I thought perhaps we could look at what Modern Maturity put together to see if that's something that we could use. And then I was thinking about some places that could act as community navigators, and some of us are on the phone. I'll count myself in the senior center community still, but the other organizations here that could be used to disseminate it. But I thought too that there may be some non-traditional sites that could be a resource, places where people shop, where they go out to eat, and especially older adults, like Crossroads Restaurant and the Hollywood Grill. And there's a group of older folks that go to Panera on Kirkwood Highway every morning. I mean, some places like that where, as I said, are non-traditional sites. I certainly would promote senior centers in that group, but that maybe there could be some community partners that way too. So anyway, those.
Is the thought process, because when we talk about outreach and disseminating information, is the thought that we're looking as a state for sort of a one-stop shop, and then being able to have all of that, like Sue was talking about the non-traditional, areas where seniors may gather that we could disseminate. But are we looking at having sort of like, a funnel to one point, like the ADRC? We want everybody sort of registering through that group so that we do have all of those lists? Or is it sort of, are we looking in that direction? Or are we kind of going in the opposite direction where whatever information that we can get out there, we just want to make sure that we're getting out there? I'm just trying to put it together in my mind.
I'll jump in, at least for the mention of the ADRC. I think, well, I want to promote the ADRC as a one-stop. We're not everything, so the state certainly isn't the entirety of the service system. And so I've been thinking back and forth about, the role of the state as one of the pieces of the service system, and how to elevate information about what's available through the state and make sure people are aware. But at the same time, I think that there are an equal amount of community resources that are available. And so how to your point, Maggie, how to make sure the array is known. I mean, I think 211 and ADRC are both good clearinghouses where there's, the majority of that information, but you have to know to even call there in the first place, and you need to know what you want to ask for. And so I'm wondering if it's more, I've been thinking a lot about creating an awareness for caregivers, meaning, first of all, name it and help people identify as such. So just start there. So I'm wondering, that's along the lines I've been thinking of in terms of information sharing and outreach, is not so much, I think, in combination of making sure if the guide is helpful, it's available everywhere. If the phone number is helpful, make sure that the people on the other end are aware of every possible service that exists. But at the same time, I think I've been thinking a lot about making sure that Delawareans identify in a way that they can, I'm a caregiver, I need caregiver help, as opposed to just saying I'm a wife and I'm doing my job, as a wife. And so I don't think I answered your question, but I've been struggling with it too. I think state driven is going to shortcut the whole system, because there's more to the system than the state. But I think we could use the ADRC as one of the central points of information dissemination. And I think while we have a lot of efforts underway right now to strengthen the ADRC, maybe there's additional linkages we could look at to make sure that we're not missing out on, just other community resources that are available and standing up. And while I was talking, I saw another person hop in that Teams environment for our meeting, because there's a Teams link as well. So, but I think I have to leave to be able to get in there. So, Anthony, I'm sorry for the break in protocol here, but I don't know if it's best if I leave and come back, or if is there any way we can grab her over there?
It's certainly fine with me. Okay. I'm also happy to jump on myself if that would be easier for the continuity of the meeting.
Thank you. Are you able to get over to that Teams meeting?
I believe so. Yeah, I mean, it should be on the invite that I have as well. So.
Okay. Would you mind sending her our direction?
Of course.
Thank you so much.
Yep.
All right. Sorry about that.
Well, I hear what you're saying, Melissa, and I fully support that. I mean, I think that the services from the state continue to do what you're doing and build on that, but finding those community sites too, and also for caregivers, but even people who just are trying to navigate the whole system of getting older. I think that having a real person as an assist for the navigation is so helpful. And if, and again, I'll use senior center, but if somebody goes there because they're regularly going to a senior center and there happens to be someone who can sit down with them, who's right there where they're already going, I think they're more likely to access that support versus, some place that's not on their beaten track. I also wonder if there's a way of engaging the older adults who we're trying to support as vital contributing members of our state, and train them as community navigators to be in those places. I mean, I realize we kind of have to put COVID aside because we still are in the pandemic, but I'll just look at myself. I mean, that would be the kind of thing that would, with my time, that I could say, well, I had this experience. I could go to someplace once a week or whatever and sit down and be available for folks to talk to them about the kinds of services that they need. And so I don't know, that just came now, that if we use the people that we're trying to support, that will also reinforce the view that people can continue to contribute, that they are vital. So it could be a double message there.
A peer network.
Right.
I've been talking a lot about the value of peers, and again, back to caregivers, in that it's been really remarkable to hear how often a caregiver is able to understand and access services because another caregiver took the time to outreach and say, here's what I've learned. And so while I think I would love for all caregivers to understand more about what services are out there, I would really love a way to foster that sense of community. And exactly to your point, Sue, use that peer strength to meet people where they are, to help share information. It can be a volunteer network, in large part. So, how do we harness that sense of community? And I really see, for the most part, they, individuals want to pay it forward and say, I really wish I knew this at the time. And so I'm happy to share it with you now in case it's helpful to you sooner. So give places like all of the examples you were given, where people are not necessarily a state office building, but a Panera where they might meet for coffee, and, maybe make those natural settings more open to sharing information, I guess. And that's where the ideas stop for a minute.
Melissa, my apologies for jumping in here. I actually, when I jumped onto the Teams for this meeting, I wasn't able to find anyone. So
okay.
they hopped off, I think. So
too bad. Okay. Thank you for going over there.
Of course.
So I guess if our job here, our role is to come up with recommendations. Do we want to, I think we're circling, around what it is we want to think about and do. Would you like to tackle it from, I guess, where, how do we want to structure our recommendations? Do we want to start from information sharing, peer networks, or maybe just kind of list the things that we believe would be beneficial, and then maybe we can get back to what that exactly might look like, but we're at least recommending and advocating for community navigators. That may also include volunteer people who have either accessed the system or want to help or are just familiar with it, have been in the situation that individuals are in. So use peers, volunteers, and others as community navigators. Maybe if we flesh that out, where would they be? How do we envision the central point to find the navigator, and then how do you get hooked up with one? Could it be if it's a volunteer network, I think that could look like one thing, as opposed to if, we want to pay them and have them specialize, because, for example, with the state, we have navigators that help specifically for memory care. So helping families understand and identify memory care and dementia-related supports, and then stick with them for the purposes of helping them identify all the different pieces to put together. So there could be global navigators that are, generally helpful in kind of getting into the system and understanding its landscape, or service-specific navigators.
I guess I was going to jump into, I love the idea of, volunteers and everything. I just would also think too, we'd have to provide some sort of training and resources to those volunteers to confirm that the message and information getting out there to the community is all the same and accurate.
Yep.
So just putting that out there too, as we'd probably have to develop something.
Melissa, is RSVP still I guess functioning? I mean, I know that things changed a lot with COVID. I haven't had much contact with them in a good while. So I don't know what's going on there, but I totally agree that people have to be trained and have the right resources and have some kind of a check-in system, so that if there's a referral that needs to be made because it's more than a volunteer can handle, that all of that is outlined. I mean, I think there would certainly be work involved. You can't just give somebody a list and say, here, go sit in Panera and talk with people. But I didn't know if RSVP was a vehicle for that, or AARP, or.
I don't know, because I also haven't heard a lot, but it might just be because we're not in the same realms right now. So I can take that as a follow-up for myself. It's just kind of getting the status there. And then we also have a couple of different outlets for volunteers. So I could, as a homework, go back and just look at what those entities, at least as they relate to the state, say about this idea, and what we might want to think about. So let's see.
And then, as you mentioned too, maybe an opportunity for, paid community navigators. I just didn't know, going to the budget, what that would also, look like.
It's why I gravitated to volunteers, even though it's certainly not the end all be all. And yeah, so where would they sit? How would, what does that look like? I think we shouldn't not recommend it if it's a good idea, because there's a budget impact. I mean, I think we have to put out the ideas that we have on the table and go from there.
Absolutely.
So, when we're talking about aging in place, the State Division on Aging could be a place where we talk about navigators. I think we have a lot of it in place already. I mentioned our nurses. We have a couple of nurses that serve as navigators specifically for dementia and memory care services for families. And then we have a small army of case managers that we, try to continue to put information in, and they can help with options counseling, direction, in addition to the ADRC. So if it's not through that general avenue, what are the places where we're missing an opportunity? Maybe that would be that, we know what we have in place, at least on the state end, for people to help direct and steer people towards resources. But, if you're not going to naturally access the state in the first place, or if you need someone to just kind of grab you at a different place and say, I think there's some services out there that could be really helpful to you, where could we place them, and how would we get them there? I guess is one of the questions I have.
I think when we're looking at the older population, most of that filters through your hospital systems, whether that's either rehab or when they're kind of at that mode of crisis. Something has changed. what is this going to look like when I go back home? You know, a major event. It would be great just to have some sort of linkage in the hospital. And even if it's not having maybe a state navigator there, which would be great, but having at least the education to the social workers, because social workers are required to do that, you know, part of the discharge planning before somebody exits, to say, here's what we need to do. This is what we're going to set up for you, whether that's a next appointment. But if they're, you know, of a certain age and looking at what their family unit system is, what support they may or may not have in the community, I would think, just in terms of maybe an extreme example of somebody who's maybe in a hospital, that would be a great starting point. But I think for those that maybe they're not in a crisis, I think what you said, Melissa, earlier, what's kind of sticking with me right now is the label, right? So I'm not a caregiver, I'm a wife, and I'm doing this for my husband. Those are the individuals that are going to be a little bit harder for us to tap into, because they're out in the community. They've been doing this for a period of time, and they may not see themselves as somebody needing that. Then how do we meet them where they're at, versus an easier example of somebody who's in crisis at a hospital? You know, we could tap into that sort of resource. So I don't know that I answered any question. I just kind of went in two different directions.
So I have an add-on to your idea. So I've been, we've been standing up the homebound vaccine line. So I'll use this opportunity to make sure everyone here knows about it as well. And that if you need a vaccine in your home, you can call our 1-800 number, and we'll schedule some time for a pharmacist or a nurse to come out into the home and vaccinate you and anyone in the home that needs it. And we'll offer a flu shot at the same time. So we're working with A, B, and C, a marketing firm that's done most of public health's COVID outreach, on making sure that we get where people are, especially if they're homebound. And so one idea we were talking about is in pharmacies, knowing that caregivers are picking up medications for individuals and bringing them home. And so maybe stapling it right to the medication bag as, just an advertising piece. But from there, we also thought that's also where we might start grabbing caregivers and naming them as a caregiver, so that they can start to identify when we advertise services. And so we're already in the path of kind of conceptualizing what that would look like, how to start a campaign to name caregivers as such, so that they know there's also these services for this thing called caregiving. So I guess just to pick up on your thought of where to reach people, one is we're very invested in moving forward in naming caregivers, so that they hopefully will know to ask that there is services and there's this whole opportunity for support. But also, where can we reach caregivers if maybe they're the best vehicle to reach the individuals that they're caring for and serving? And so I just wanted to add to the list, maybe pharmacies are another place to, I think, see you listed nice community settings where we'll just catch people where they are, not necessarily where they're looking for services.
I think that's a great idea. The pharmacies, and when you mentioned the A, B, and C agency, I was going to say that older adults are using social media, and even using social media as well to have a campaign and to have something that's going to grab people's attention. So I don't know if that's something that they would do, but that could also be a mechanism, and maybe using the Senior Center Network. Most of them have Facebook pages, and some even have Instagram. I mean, getting them to put it out on their pages as well, so that it is more, has a larger reach. So I think, and I was thinking of the whole message about healthy aging and fighting the stigma, and thinking about some kind of messaging campaign. And I think, there could be a tiered approach. I mean, we want to get to people and get the information to them so they can access services. I would say that's probably our priority. But that same system could be used to with the anti-ageism messaging as well. So it could be a process.
Like a journey, where we start.
Yeah, right.
Change the messaging and the language and the approach.
Yeah.
And I think churches are a big faith organizations. Faith-based organizations are a really big avenue for older adults, and it's always a little bit challenging to tap into all of those markets just because of the diversity of it, and there's so many. And but I think if there's a way for us to connect with any faith-based organization, I think that would be helpful too.
Mm-hmm. And I'm wondering if that's where we could recruit and place some of our navigators, our community navigators.
I think so. Some churches have parish nurses. There's that network, but also there are organizing bodies. So like the Presbyterian churches, which there's a lot of them in the state, the presbytery is the judicatory that oversees them. So if you go to the presbytery level, they can disseminate it to all of the churches, and then the key engage them in finding the key locations across the state and other denominations as well. But I just know that that's how they're organized. I mean, the Catholic diocese, the Episcopal diocese, the Muslim community, the Jewish community, I think starting at that higher level and then having them get it to the individual congregations and maybe identify some ways to cross those communities. So I think that's a great idea. I know that the Stand By Me coaching model for the 50+ program, they have coaches who are mobile, so they go to different locations. They may not be in their home base very often at all, and I think that same model could work with both paid navigators and volunteers. And typically that's what we did before there was the ADRC way back in the early 2000s when we established the Delaware Aging Network and had funding from the Community Foundation and AstraZeneca and United Way. That's what we had, was community care managers, and they went through they did exactly this, and then times changed and funding changed, and so anyway, I'll be quiet.
Well, I would be interested in the history so we can learn from it. If we get down there in the recommendation. I'm sorry, Matthew, you were going to talk.
No, all good. Yeah. So just to piggyback off of everything, Maggie mentioned to like the hospital systems or facilities in the area. I don't know if we could tap into any social workers like networks so that they're also aware of the navigators as a resource, and then also to like providers like myself in the home health niche, so that they're aware too of the different community resources out there. If they weren't the provider that could help in this situation, at least say, hey, you know what, there is a community navigator that can give you some additional details of where else to go or what else, or who's the right person to help in this situation.
So I really am interested in how it looked before, but were there like a cohort of trained community navigators that were either volunteer or paid, and then they might have a hub, maybe a state or a programmatic contact, so that I'm thinking it already almost works this way very naturally, where we'll have a church member refer, call our ADRC because they're worried about someone that they know through church. And so they're already looking and watching out and making those outreaches. And so I'm wondering if we give groups or cohorts, teams, maybe even of these navigators, a contact or a hub where they can go back, they can share information, have a point to ask questions and make sure the referral or the information travels. I'm thinking paid or not paid, they're going to need a really solid point of contact to make sure that, if they get stuck or just need to take it to the next level, that they have a really warm handoff rather than just, kind of acting on the state service system at large. So And any
I-
lessons? Go ahead.
Yeah, I think that's a good idea. I mean, there would have to be some place where that coordination happens. I don't know where that is, but.
And me, I'm always looking to learn from what we're doing so we can do it better the next time. So I would even want the data to say, okay, well, how are things going? How can we make it better? What are the common questions you're receiving so that we know we need to do a better job getting that information out or identifying service gaps. I think there would be a lot there to get systems information from if we had a team of community people.
So, Melissa, in other states that I've worked, typically that's how that would look. They would all, and it's a little bit different, but typically the ADRC was sort of that main point because it was at least the phone number that people were familiar with. I think North Carolina used to do it this way. Texas used to do it this way, where everybody sort of had like a magnet or something on their refrigerator that had that main number. And while a lot of that didn't go, it wasn't the responsibility of the state to manage all of it. The state was the main point of contact that people at least knew what that number was to say, okay, let me start there. And then the state would, depending on the state would say, okay, well, let me connect you with this group or this group or this group, depending on what, after they did their information and, assistance piece, and they would get all the general information of what this person was looking for. Then they would sort of disseminate them to whatever the appropriate service recipient, or contract, whatever that looked like. But so that's why I think that was my initial question was, are we looking at having at least that main point, that main number, somewhere where that is the people out in the community know, okay, I might not know what I need, but I know where I can start. And I think that would be helpful. And then even if it's having those community navigators, what I've seen work in other states as well, is that those community navigators sort of floated to different places. So there would be a case manager that maybe, twice a week would go sit at different senior centers. They would be that person that could answer questions. And we used to actually do this for SHIP as well during the enrollment time for Medicare, right? Have somebody there, they could answer questions, even if it was from 11 to 2, when we know everybody's there for lunch and they're socializing. And that would be that main point of contact to say, I'm not sure what I need, or, I have a neighbor and I think they need this, and get that connection out. And then also for faith-based organizations, kind of the same thing, and typically it was somebody who attended the congregation and, that was part of their Sunday, but they would volunteer their time to sit and answer questions after different services or whatever. But that's how I've seen it typically work in the past. I don't know if that's, Sue, it sounds like you have some experience. I don't know if that's maybe different from how you've seen.
I think it's similar. I mean, we were doing it as private nonprofit, connecting with the state, but had separate funding. And then I don't know when the ADRC was established. I can't remember the year, but things as funding streams changed, then the navigation that the folks were doing, and we had funding to pay for a care manager in each of the 3 counties. So it was Jewish Family Services, Modern Maturity, and Cheer were the 3 organizations. And then they had a person who went out into the community, shared the information, and then were a resource. So it wasn't as centralized with a number statewide as you're talking about. I think as the ADRC developed, then that function pretty much went to the state, the navigation process. Although JFS has continued to provide care management, navigation services, but now people have to pay for it. Before it was a free service. So I think we're talking about what I hear Melissa was saying was, we need that central number, as you said, which probably is the ADRC or 211, and maybe build up the promotion of that, but then also have a more informal network, or more, I guess that's the right word, informal, just of the people who are in the sites, like you said, at the churches or senior centers, but trained enough that they would then get back to the ADRC probably if there's a need. So I don't know if that makes sense.
Yeah, I would agree with, I think Matt was talking before about the training piece. I think if we're looking at the volunteer or, a generalized service, I think having, making sure that we provide those individuals that are out there, giving the information or the resources, that they sort of have that arsenal of information behind them, and making sure that it's all standard across the board, because, we want to be consistent in our messaging. So I do agree with that.
Well, you mentioned the SHIP, and so, the Delaware Medicare Assistance Bureau has trained volunteers that are available, especially for open enrollment, but also other times during the year. Now, that's very technical information that they need to know, and they go through training, but that kind of model might be useful. And I know that there are key volunteers that are called upon during that time, but that would be a system that would have, structure to it. And that's, I guess, you talked, Melissa, about global navigators versus service specific navigators, and that would be that kind of example. So, the healthcare could have that could be another service specific healthcare and in-home care. I mean, that could be one cluster. So there's a lot of ways to structure it, but
So I like, I'll back it up, that I think the ADRC and 211 together could be, that centralized place of where to funnel people if they really, next steps. And Maggie, I love it that you brought up other states are doing similar things. And what I could do is add to my homework list just some research on what this might look like. And I'm also interested in funding streams, because I think it could be stronger, obviously, if it was, I think there's something there with volunteers for sure, but obviously if we could have paid even part-time or hourly people to help with this, we could probably get a lot further. So I'll ask our partners at Advancing States who have access to all the other state agencies on aging if they have some ideas about how this has looked, and maybe some funding ideas as well. Okay. I'm going to look at our list again. Thank you for reminding me, Sue, that there was the bullets, because I think those are the best ones to go to. Okay, so our bullets included everything we just talked about, the utilizing navigators for programs that partner with the state, but not necessarily public employees. And then also encouraging and promoting proactive steps to aging, and fighting stigma and negative connotation with accessing services and asking for help. And I'll tell you, from the other subcommittee I'm on, and then I think this has even come up in the big group, asking for help earlier, it seems to be such a piece that we all agree on, and just how to start that conversation. And I think it's so tied into the negative feelings about aging that it's a conversation that for some reason is difficult to start. And so everything from financial planning to beginning to think about what your home looks like now and what you want it to look like when you're older, all of those parts, how do we start the conversation? And I think we certainly have the idea that a public campaign could get there, of just using different language and purposefully talking about it differently. But I think there's so much more there. And I'm just interested to hear your ideas on what either you've seen that's worked really nicely or really struck a chord, or what you wish you would see kind of at the state level to push aging in a more positive direction.
Well, I was thinking about that there's a lot of messaging in the state, but elsewhere about protecting vulnerable populations from COVID, and from the vaccine to masking to whatever else. In fact, I get the New York Times daily newsletter, and there was a good I think there were 5 points for protecting vulnerable people. And so I think, we want to do that. But unfortunately, that's the image that gets portrayed, is these people are vulnerable. Well, I'm in that age group. So yes, I am vulnerable, but I'm also active. And I don't know if there's a way of saying, we want you to live your best life. So that's why we want you to get the booster. I mean, I don't know if it's even that I know there's probably no changing that, but it's that I think has only reinforced the negative image of aging, the whole COVID thing. And so I don't know, but I was thinking about that. How do you get the message across without diluting the other side of it, where people are vulnerable and they do need to be protected? So I don't have an answer.
I know this is probably not in the budget, but I'm just going to throw it out there, like some sort of, to kind of piggyback off of what Sue's saying, some sort of media campaign, where we're pushing out the message, because I see, commercials like get your, vaccine and everything too. Well, longer term, this is really important, right? So people are educated, understand the resources, and can age gracefully and know what's out there. So just putting that thought out there.
So I'll say I'm selfishly picking your brains because it's something we want to do, and we're still trying to think of how to get started. And we've used language like talk about terms of vitality in aging rather than vulnerability. And I feel like there's also something to stick with the fact that the aging period of your life is almost half of it. So why are we kind of, just casting it off as aging when it's a good portion of hopefully any individual's life, and how to really embrace that with all of the positive things that come with aging, and start to just turn the conversation. So ultimately people, at least in Delaware, maybe, don't feel as negative towards aging. And then maybe that'll open up more opportunities and interest in accessing services, of course. But then with that, we want to support it with, here's ways we can help you age better, from everything of supporting physical activity to nutrition to financial planning, all of it. But I think for us, it feels like it has to start with renaming it so that it's something people want to think about and engage in and really believe. And I think it's also, where do we see sneaky language that gets in there? Because if you look, synonyms for aging are usually pretty negative. If you just go in, it's withering and, moldering and just really bad language.
Let's not use that. Don't use withering.
So
as
yeah, but I think it's the language is pervasive in the way we talk about it. And, obviously we're an uphill battle, just the culture of America, but, where are those places we could start to make a difference in the language that we use, and the way we talk about those people who have moved into that phase of their life.
I think the other piece of it too, from, just being in the environment that I'm in, and, I've worked with seniors my entire career, and their perception, whether it's this generation, the generation before, the perception is that they don't want to be a burden. So breaking through that, that this is why we're here. This is what we're here for. We're here to help support you. Because I think there's also the tenacity to say, yes, I need help, but I don't want to put anybody out. I don't want anybody to go above and beyond for me. I think is a very large, I'm not saying everybody, but I would say a lot of the seniors, that's kind of their thought process. No, I'll figure it out on my own. Meanwhile, they're really struggling, but trying to break through that barrier, I think would also be helpful as we're thinking about language and how to move past. I think that would be a good one to think about too.
Yep.
Yeah, the whole idea of independence. We want to be independent and, like you said, not be a burden, not give up anything, like heaven forbid we have to give up driving or something like that. It would be nice to have champions across different cultures who could represent in this Matthew's media campaign. If there could be some spokespersons that would be consistent. Of course, our poster family are the Joe and Joe Biden, but I don't know if because they're certainly in their older adult time are out there. But I mean, I just think that a cross-cultural champions, that a team of folks that would represent, and if there were ads or billboards or even on the materials. And I'm talking about real people, not the great clip art that's out there or the stock photos. That there's some people that I see quite regularly, and I know that their picture was taken in a studio far away.
I love it. I mean, I'm thinking of some of our, you're right, some of our leaders are in that zone, and why not show, they're still, look at the things they're doing. This isn't the worst of aging. This is the best of aging, is, really putting your whole life, to where you are at the moment.
I'm going to throw out a term that I've heard in years, that the golden years, like that feels better than, aging. There's a positive spin on it. I think it's a great portion of life too, and you have a lot of life to live. And how Sue's saying to be independent, but I don't know if we could play on the golden years as something too.
I definitely like the golden years better than withering. I think we should really go in that direction.
Agree. Well, I think there's something there, Sue, to grab onto. It's the basis for which we've built our, at least with our agency, with the vaccine campaign. We use real Delawareans, and so I'm wondering if I can just start to keep them closer, as we develop this as our public-facing champions of aging, to really show that these are the golden years, not something to be worried about, but to be celebrated.
I forget, I don't remember who had said something, but in thinking of those non-traditional arenas where we could tap into, I wonder with financial planners or attorneys, things like that, when we're thinking about where, that population is right now, and the connections that they're making. I mean, it's definitely a different kind of population if they're in financial planning. Obviously, their income's going to be at a certain level. But it shouldn't preclude them from, accessing if there's services that they need or caregiving support that they need. But that might be and also like another area that we could tap into just for support of disseminating information.
And I think we can grab on to the other subgroup, the social determinants of aging. Well, there's this was a big part of the conversation we had last week. There was an individual, and I'm so sorry, I'm forgetting her name, from elder law, estate planning, and then also someone from community legal aid. So kind of both that, to your point, both those that have a lot of assets to plan for and those that really don't. But on both spectrums, they were saying the same thing, that we just need people to come to the table sooner so we can have the conversation and put things in place so it's not, in the last minute and in an emergency situation. So I'll note this for a crosswalk and see if, how far they want to take it, or if they want to kind of jump on our idea of messaging.
And people with more assets are probably less likely to call the state for help, but they still need it as caregivers and just as aging adults.
Agreed. Well, and maybe that's something we need to do as the state, is try to, I know we're trying to make services that are more available to the broader Delaware public, but how do we start to message that too? It's not your standard state service here. It's, we can help with linking you up with financial planning. We can link you up with caregiver supports. It's not just personal care, for example. It's so much more. And if you're a caregiver, there's this wealth of opportunity to access information and resources and respite care if you need it. To me, it looks like we have two primary, at least from what we've talked about, but I don't want to lose sight of what we kind of agreed to as a larger group. So it looks like we have a fairly well gelled idea around community navigators and what that could look like with a little more research. And then also a purposeful campaign to start to change the language on aging to the end that we're encouraging people to access services and preventative services as well. I was impressed with one of the Super Bowl commercials that seemed to kind of target the getting your screenings, and just the reinforcing message that just keep up with the screenings and the preventative medicine as part of healthy aging. So a purposeful campaign that will start to steer there. And I think that's an area to talk with some of the other subgroups and see, because I know for sure that's been a topic of just how they're thinking about it and maybe how we could come together with a recommendation for what that would look like. So beyond those two things, are there other pieces from the minutes or the list of bullets he sent out? And I can share the list of bullets if you'd like that. You wanted to explore. Would it be helpful if I shared the list of bullets? I think I saw Matt. Yeah, okay, I'll do that. I think this is it. There we go. Well, I think the first bullet maybe is the one we have left to maybe do a little more work on, and that's what would the goal and outcome be of the two kind of initiatives? I think we talked about that. So the goal, obviously, of navigators would be for connection with an outcome for making sure that individuals know where to go. They have people who are outreaching to them as opposed to waiting till they need it. Embed people in the community to act as peers. I'll leave it to you guys to see where you want to go next.
So I think the second bullet, Melissa, you were talking about improving information and resources, developing effective means of disseminating. It sounds like you already sort of have a step up with the pharmacy, utilizing the pharmacy partners.
Yeah, I can tell you what's in the works, at least from the state perspective. And again, I really don't think we should be the only sector, offered. And so I would be really interested in what we could add on to what we're doing to make sure it's comprehensively available to Delawareans for everything, state and community. So we have the campaigns for vaccines, both for access and hesitancy, but also the homebound population and making sure everyone's aware of that. But we wanted to leverage that to then begin to start to reach caregivers to identify as such and really try to help them identify as caregivers, so then we could make sure that they know about services that are available. And we're really thinking of the navigation, information. We have reach courses through the Rosalind Carter Institute and caregiver resource centers. Anyway, driving them to really start to access those services. Beyond that, we would like to start healthy messaging, but just felt a little premature on where are we driving them, to what end, other than just changing the language on aging. So that's as much as we've got in place. We have a lot of efforts to build up the ADRC. We've moved it to have the same backbone as 211. So they're going to be more and more hopefully streamlined and interoperable. And also just increasing the education of our ADRC staff so that they're trained as professional information referral specialists, and also continue to give the most accurate information. So beyond that, though, I'm really interested in how we could leverage that to other resources you're available, or gee, I wish they would do that, and make sure people know about that, or make communication open a different way. But that's kind of the status of where we are for now.
I'm not sure. I mean, I think we've talked about a lot of goals and values under the different categories here. We haven't talked, though, a lot about the social isolation piece of our, the title of our subgroup. That's the one thing that I think we've focused on promoting access to support services, and hopefully have the goals and so on. We haven't talked so much about that, so I'm not sure where to go with that. I mean, of course, I would propose senior centers and other organizations like that for supporting it, but there's also the connection with people and who don't get out, or who aren't going to go to a senior center because that's for old people, but they still could benefit from the socialization and the resources. So that's the one thing I see that maybe we haven't discussed as much.
I guess if we think about it, though, like the outreach and resources and everything that we've already discussed, isn't it almost indirectly addressing that too, right? Like we're proposing all of this, campaign and resources and navigators. If we're getting out to the people and connecting them to other resources and other people or community events or what have you, then we are addressing it. We might not be calling it directly, combating the isolation, but I think we are.
Well, that's a good point. And you're right. And perhaps one of the resources, and we could call this out, but one of the resources that the navigators for wherever they come from could provide are some of those opportunities for social interaction, whether it's in person or online, or like you said, community events. But that could be, if we name that as one of the resources that would be consistently provided, then I think that that's a good way, you're right, of addressing it through the promoting access. So thanks, I like that.
Melissa, there used to be a group, and I don't know if they exist or if that's even something that's in Delaware, but there used to be a group called Visiting Angels. And it was a lot of volunteer type. So when we're talking about the community navigator and those individuals that are paid and disseminating information, tapping into a group like a Visiting Angels, right, to actually, help support not just the message, but also, to Sue's point, that having that visitor that's coming in pretty routinely, not just as somebody who visits, but now also has resources to share. Because I think while, I definitely agree that the benefits of a senior center or day program, are right up there. We do have a lot of seniors that don't, that's just not something that they want to, a step they want to take. So again, thinking about how to meet them where they're at in their home, but still combating that isolation and providing that access to support services. How can we get that information out there? But does Delaware have something like that? I actually don't know the answer to that.
So you brought to mind a slightly different program that Lori's Hands, I think it's called.
That's what I was thinking.
Yeah. And I think that's such a, grab those and just start trying to leverage them even more. And I was just personally chatting with my parents yesterday. My dad's newly retired and has no friends, but also doesn't want to go out. I mean, I shouldn't say that about him in public, but the dilemma of what do you do now that you have your whole day, but not people that you normally used to spend it with, right? And so, we were joking that COVID is perfect for introverts and has made everyone else pretty partial to being introverted too. And so, how do you, especially now when people are probably less connected than we've ever been, introduce a connection that's going to be appealing? And I think that might be the number one challenge, is putting something in front of people that they actually want to do rather than a forced social experience for the sake of being social. And so everything I've heard about Lori's Hands, and I'm glad you guys were all aware of it, has been really powerful. But maybe it's a scatter shot of a lot of different kinds of things, so that, kind of like everything we've talked about with this work group, you've got to meet people where they are, and it can't be a one-stop shop. And so maybe again, that's those, to your point, Matt, the peer navigators, maybe in some ways those can be some of those outreach. Maybe we leverage the college students, or agencies like Visiting Angels, kind of leverage all different levels of types of, interaction. And that way it could appeal to different people. I still don't know how to make that connection though. How do you encourage someone who doesn't have a lot of social interaction to seek it out? And then how do you match them up? I think has been the challenge we've been thinking about a lot. And on the other hand, to introduce virtual, I think that there's a lot there to build on, and that we've learned pros and cons, and we learned that broadband is a bigger issue than we ever thought with all of those. But I think it's a different avenue to pursue if we're talking about isolation, and that I think, at least personally, this isn't the same as sitting with you all in a room. And while it brings interaction when there is none, and that's positive, I think I personally would want to look for ways to offer truer connections than these, and this could be, another means to get it to deliver information and services, but just continue to look for that human connection as opposed to, virtual programming as a way to combat isolation.
As you were talking, Melissa, about your parents, my parents are sort of opposite ends of the spectrum. And, my dad is so not tech savvy. There was that call from the IRS, and he, start giving them address and phone number. And next thing you know, his social security number is coming out. My mom is very tech savvy and grabbing the phone from him and, doing all kinds of stuff. So, but when I was thinking about them both being retired, where do they go? What, where's sort of those places that, since COVID, that they feel comfortable? And the other thing, really the only place they go is the supermarket. And when you go during certain times during the day, tapping into those areas where, would you send a community navigator there? Maybe, maybe that's something that we're thinking about, but that's, my brain's kind of going in like, where is it that the seniors, once they're retired and they're not around the people that they were during their work time, where are those typical avenues that they would travel in terms of when you were saying like connecting them to those individuals?
I think we mentioned too some hot spots for restaurants and everything. And I think as people get more comfortable, we're on the downward slope. Hopefully continues with the pandemic. I think restaurants is one thing, and then I'm going to. This is probably not even an option, so I'm just. Like people that are tech savvy, right? They might use Grubhub or other delivery methods. Can we tap into some informational piece to those outlets as well that are actually going to people's homes and dropping stuff off? Could there be something there? I don't know, but just throwing that out.
We've talked a lot about the inserts, both with home delivered meals, but also, Instacart grocery delivery and and food delivery. I think it's all good. So I wonder, have we ever tried anything like almost a fun kind of fair, in the grocery stores. Cause you got me thinking, Maggie, about people who may not go anywhere will go to the grocery store. And there's actually probably peak times that we could grab the majority of the folks that are going to visit the grocery store that are in our target area. And then, stand up something in the grocery store that'll catch their attention, kind of grab them right there, but have it regularly standing so that it's exciting enough to stop for a second, and then you grab them and you offer, information and resources and maybe even a connection that they might stop by the next time and talk a little more the next time.
And I think the good thing too is there are some supermarkets that have those senior hours. There's the designated senior time, as whether those are kind of early, 6 to 7 a.m. But that's when if they have a designated senior time, it might be beneficial. But yeah, my parents don't go anywhere, but they do go to the grocery store.
Yep.
I think Acme on Tuesdays, you get a discount if you're a certain age. So, those, because somebody came up to me one day and said, and are you, I don't remember how she asked, because I didn't, it was at the self-checkout. How old are you? And I hate when they say this, young lady. I just want to go, but anyway, I took the discount, whatever it was like 50 cents, but I took it.
But I do agree what you were saying with Melissa too, right? If you have that person who's there, that consistency, they're going to see that individual, they'll feel more comfortable. It might not be the first time they go that they ask questions or pick it up, but maybe the second or third time it's a familiar face, somebody who smiles and says hi. And, if they see those key words or phrases, the golden years or whatever marketing phrase we use, it'll at least maybe hopefully prompt some interest, maybe some questions. And then that familiarity and consistency, I think, would also be helpful. But I like that.
I'm thinking the neighborhood where everyone knows your name kind of approach. I know at my local grocery store, people know each other's names. And so if you just kind of put a plant, then maybe that's the way to get that connection. I think that also gets back to the navigator and the need for a mix of both volunteer and paid, because that consistency is important, but I think consistency might require a little more than goodwill, to get somebody to show up every time.
And you know what else will grab people's attention is puppies and kittens. Now, I'm not saying have them in the grocery store, but with the campaign, I mean, people will look at that, and if they see, even just an older couple playing with a dog or something like that, and that's the image of vitality, that you're active, you're out there, and you've got this cute little dog that you're playing, that gets people's attention. So there could be a mascot.
Yep.
We need an aging version of Gritty from the Flyers. Somebody's just really out there, but makes people look.
I was going to say, I don't think any other work groups who is going to have a mascot. So
the representative will come back and say, what have you done with this work group? He came back with the mascot. Now, I think we have some really firm suggestions and next steps. I think with even some kernels that exist already, and it might just be building and leveraging existing resources. It sounds like we might be building on, programs of past and improving some things we've done before. Get one last thought, and then I'll open it to whatever you guys where you want to go next. But again, with this idea of planting people in places where we know we'll reach our seniors and our target populations, I think again this is one where we could really look to leverage beyond the state. In that, I appreciate the state's a center of services, but it's not the it's not everything for services, and it may in many ways not be the services that are right for that senior. And so just to bring up that, I'm wondering if there's also ways to think about leveraging community partnerships and other faith-based and other communities to be part of the outreach campaign, and that it may be, again, hubs where they can train and refer to state services, but just, I think the state sometimes is a turnoff to people. And so if it felt more like just warm outreach as opposed to selling the state services, it might get a little further, at least until our identity as healthy aging is a little more firm, and then maybe they'll feel better about it. But just thoughts about how to leverage community and as part of that outreach campaign, specific around isolation.
Melissa, can you, when you're talking about leveraging community, do you have a thought that you were sort of going down? I'm trying to follow you.
Yeah, I'm trying to follow my own thoughts, and I'm sorry. I feel like I have a loose idea of,
because I love the idea of the leveraging community partners, right? There's a lot of us here. There's a lot of us that, may see, I may see individuals that Matt doesn't see, right? So, being able to leverage those community partners to be able to tap into as many people as possible, I think it's a great concept. I just didn't know if there was, even if it was a skeletal structure behind your thought, what you were.
My best example, I think, of what I had in mind is faith-based communities. Again, my experience is so many of our referrals come from people who are concerned about a fellow member of their congregation. And I think there's something, and tying that to the concept, I think community is really important. I think that people feel better about connections when they feel like it's part of their community and it's a face they normally see. And so putting all of that together of, who's in the community already, who would be inclined to take this different avenue, or already trying to help in a different way, that maybe we could tap into that so that it feels local, it stays local. I think that's where your connections can really start to blossom, and they're not as forced as, kind of just putting in a peer or a friendly face. So I guess that's as baked as it is so far. It's just how to leverage the community around the person so that it's people who are familiar with the community, more like them than not, and more familiar and easier to reach out to. But I'm not sure how to create that network and then lift and leverage those partners.
But I wonder, because I think that would be a heavy lift for anybody. But I wonder if, kind of going back to what Sue said earlier, when we're talking about having those community navigators, it may not necessarily be that the community navigator shows up at each of the congregations, but maybe they sit once a month with, sort of the higher ups to hear about, or at least talk about maybe the resources and the services and, what's happening from, the perspective of resource availability and, what we can provide in terms of support as well. And then that goes back down to the congregation and the different congregations for them to say, okay, these services are available for those individuals, and it allows them that opportunity to sort of check in with their congregation of what they need. But I think from the perspective of not wanting to overextend, because then I don't know that we're necessarily going to target what we want to target. I think we do need to be a little bit pointed at first to say, the community navigator goes to those higher, I forget what Sue called them, but the sort of the overarching group that then can disseminate that information to their congregation based. But I don't know if I'm making any sense.
Mm-hmm.
I would also go with I think the faith-based is good. And I know that from my own experience that there are a lot of older adults. They have been isolated. Some churches haven't met in person. So that's been difficult, or people are hesitant to come out. And so they've lost that connection that was so important to them. But also I think that maybe starting at that organizational level could be a place to start, and then see if you can recruit some of the peer navigators within that, and maybe have a model or a pilot with a couple of different places, so that you're not trying to blanket the state, but just target some groups and set it up and see how it goes, and then be able to expand from there.
I love it. That's the bite-sized piece I think Maggie was trying to say. Let's start somewhere we can be successful. So would the recommendation then be that that we look to start with faith-based communities to develop this network of peer navigators in local communities?
I think it's a good place to start.
Okay.
For the future, we could also look at it has community organizations, but there are civic associations. Some are hardly functional, but others are very active. But that would be a place to disseminate some information and maybe lead people to sites where there are navigators in person.
Great idea. All right, so it looks like once I get hopefully some good information around the states from our partners about what community navigators can look like, then maybe that'll give us additional follow-up ideas of, okay, well, here's how we could pay for it, structure it, plant them, get started, et cetera. But I think we're starting to really refine it to this concept of navigators paired with a real community-based meet you where you are campaign of reaching out to people and really softening and improving the language of aging and services so that we can get more people to feel comfortable accessing our services while we're also looking to reach them in different ways. Does that sound like a summary of where we are? All right.
I think it's perfect.
Okay. We're about half an hour to the end. Is this a good breaking point then for us to, why don't I unshare my screen? Because I think we're done with those bullets. There we go. And we have one attendee. So why don't I switch it over? Are you guys ready to see if we have any comments from our public group? Okay. So Anthony, would you mind if we go ahead and switch to public comment at this point and see if there's anybody who would like to join the conversation?
Absolutely. We have one person in attendance here. It's Rachel Gregoire. Rachel, if you'd like to add a public comment, please go ahead and raise your hand. Okay, seeing none, I think we are all set.
Okay. All right. So for you all, do we want to have? You want to talk about meeting schedule as well? Let me look. Discuss potential recommendations. We're there. Public comment. I'm sorry to do this to you, Anthony, but do you know if we need to set a new meeting date or if if the next step is just the big group meeting on the 25th, and then we'll go from there?
I do not know the answer to that question.
Okay,
but
no
I'll shoot an email to Will if you'd like. And
okay, sounds good. So we'll stand ready to see if we need to go ahead and schedule something post February 25th, I think is the next meeting. So I will, I know you've been taking notes, and then I'll also send a summary of just the things we talked about and do some homework to see if we can get some answers before the 25th. Any other pieces that you all want to take care of today?
What's the time on the 25th? I don't have that down, so
And I'm going from memory, which is dangerous. I might be wrong altogether. Let me look.
1:30.
Oh,
Thank you.
Okay. Thank you.
Okay, well then I think if it sounds like we're at a good stopping place, I think we made a lot of good progress in refining what we want to do here. And I think these are all tangible. So this is good stuff to work with. Thank you so much for your contribution and discussion today. And then I'm very novice at this. I don't know if I need to officially look to close us out or if we're good to just say we've concluded for today.
You could always entertain a motion to adjourn.
Okay, so I'll entertain a motion to adjourn, please.
So moved.
Thank you. Do I have a second? All right, excellent. Thank you all so much, and I'll see you soon.
Thank you.
Thank you.
Bye.
Bye,
Take
everyone.
care.